parietal pericardium. So surrounding the heart, there is a sac, almost like a Ziploc baggie. If you were to put your heart in a Ziploc baggie, that sac is going to be parietal pericardium. So you truly don't see it on the model. We have a stack of APR pictures over there that you will be able to see that on the APR pictures. So make sure you just put a note for that, look at APR pictures. Pericardial cavity is a space, and it's the space between the parietal pericardium and the membrane that tightly covers this heart. So the membrane that tightly covers the heart is called visceral pericardium, or you can use the word epicardium if you wish. Again, we can't see that space on this plastic model, so APR picture will be for the pericardial cavity. It says a note that it contains serous fluid. Serous fluid is kind of like an oil. Basically, the function of that parietal pericardium is when you're running or when you're exercising or whatever, that heart has to have kind of an oily membrane around it so that you don't have friction and those gentle membranes aren't like rubbing against themselves and wearing themselves out. Myocardium and endocardium are the last two. Myo means muscle, endo means in or within. So myocardium is the muscular layer. So all of this dark brown that you see here, that is all going to be myocardium, the muscular layer of the heart. Endocardium is going to be tagged someplace, maybe probably lining the ventricles, and we're going to say, name the innermost layer of the heart, or name this innermost membrane, and that would be endocardium. Okay?
What's endo meaning?
Endo means inside.
Inside.
Inside. Now we're going to do some surface anatomy of the heart, which are just the outer portions of that. You see two large pink, almost ear-like structures. These are called the auricles of the heart. How the heart sits in your body, all of the major vessels will go superior. The pointed tip will be at the bottom, and then these auricles are going to be in front or anterior. So this is how this sits in your heart. So this is the right side of the heart, and this is going to be the left side of the heart. So if we say name this specific structure and indicate right or left, make sure you put right auricle for that. Next is going to be adipose tissue. That's simple. That's the yellow stuff that you see. Adipose tissue, again, protects, the heart. The next two are relatively confusing for students. Atrioventricular groove or sulcus or anterior interventricular groove or sulcus. Atrioventricular runs horizontally and it separates the atria from the ventricle. Also, you can call that coronary groove or coronary sulcus. That might be easier for you to spell. And what you want to know is that coronary sulcus kind of starts underneath the auricle, and then it goes all the way around and wraps around the back. So it's this depression where these big blood vessels are sitting. So if I have the pin right here and say name this depression seen at the tip of the pin, make sure you put coronary sulcus or atrioventricular groove or sulcus. Now, that one goes again anterior and posterior. E, anterior interventricular groove or sulcus, is only on the anterior surface. So we have to flip this over to see this. And you can see, again, more blood vessels, but that dip or depression where those blood vessels are sitting, that is the anterior interventricular groove or sulcus. Okay, running right down the front of the heart. Apex and base. Bottom of the heart is the
Apex.
Good, and the top of the heart where all these major blood vessels are coming off is going to be base. Again, we'll have a tag here and we'll say name this general region of the heart or general area of the heart because there's so much other stuff going on, around that area. In general, the red things on the surface of the heart are the coronary arteries and the blue things are the
Veins.
coronary veins, okay? Arteries carry oxygenated or deoxygenated blood?
Oxygen.
Good, and veins carry?
Deoxygen.
Good, which is why they're represented as blue. Ligamentum arteriosum. If you look, here's my aorta, here's my pulmonary trunk. This is taking oxygenated blood to the rest of the body. This is taking deoxygenated blood out to the lungs to pick up some oxygen. There is a little connection that connects the two, and that little connection is called ligamentum arteriosum. That little blue thing that you see right there. Finally, on the back of the heart, I don't know why that's on your heart checklist, but they have the trachea on there, and you guys all know what the trachea is now. Next, we're going to take